It's just us, Lisa. I was
So far.
actually getting worried I was going to be the last one to log in.
Well, I mean, it's 3:29, so you think there'd be more people, but I guess they'll show up eventually.
Yeah.
Yeah. I know Sarah Harris is not coming, but she's the only person that has told us that she's not. So hopefully everybody else is coming.
Yes, I talked to Amy. I texted with her yesterday, so she is coming. There she is.
There's Amy and Natalie. Hi.
Yay.
Kaki's
Hey,
here.
Mary.
She'll be logging on soon.
I meant to ask you, Mary, where are you?
I am visiting my parents this week, and they live in rural Mecklenburg County, down near the North Carolina line. So they live down a dirt road, and they don't have internet in their house. They use their cell phones, but even that is really slow. So I am in the Mecklenburg County Public Library right now,
Nice.
and we'll see how that goes.
Nice.
Kaki's here now.
So I wanted to just let you all know that Erica, Jenny John, and Sam Spencer will be joining us for the presentation part, but they both had conflicts that would keep them from getting here right here at 3:30, and so they might not show up until 4, just FYI. And Mary's on vacation, and Alice was on vacation last week, and so my guess is she's catching up from that, and I'm not sure about Wanda. Wanda may join us. So all of that is to say, it could be us.
Got it. I'm always so appreciative to see so many people from your department who come. I remember when we used to meet in person, it normally was only 1 or 2 people each meeting. And so because we're having them on Zoom, maybe that's why we've been having so many staff attend, but I really like it because we get so much good information.
Agreed. And I will say that I'm always afraid of getting a question that I can't really answer, or I can only answer 20% of. And so initially I asked, my backups with Mary and Alice and wanted to be here, but I think they enjoyed being here, and so they just sort of kept coming, which is fine by me, of course. Lisa, didn't we think there would be one more?
Yeah, Willie Mae, as far as I know, should be here. She didn't say she wasn't coming.
Right, that's right. Sarah is not here, and we need Willie Mae in order to have a quorum, correct?
Yes.
While we're waiting to see if she logs in, I'll ask. I opened up the attachment that had pictures. It was called May Advisory Board Notes Pictures, and maybe it's just my download, but the third page doesn't show any photos. Do you guys see pictures on the third page? Like on mine, it's just showing the little gray things that show a picture icon, and maybe I just need to download it again.
No, that's exactly what I'm saying too for Woodbrook.
Mhm.
It's just the idea of pictures, but no actual pictures.
Yeah, I just have the little gray things too. But no, but they popped into pictures.
Yeah,
Oh,
I
yeah,
see them. The last page is blank, but I think that was intentional.
Yeah, it's Red Hill, Agnerhurt, and Woodbrook. So I think it's just the 3.
Yeah, and on the third page, I have photos as well.
Huh.
Okay. Maybe it just needs to load, or I can download it again.
You can imagine they're cute pictures of kids.
Yeah, they're very cute.
They're playing with chalk on the sidewalk.
Well, I don't want to wait too much longer. It is 3:34, so Willie Mae can join us whenever she pops in. If if that's okay with you guys, you want to go ahead and get started? Okay. Well, we need a quorum in order to approve the minutes from last meeting, but did anybody see any changes that needed to be made? I think we could suggest those changes if necessary, even if we're not going to approve the minutes. No, I read through it. It looked pretty good to me. Would you guys, you want to go ahead and discuss the information items? Kaki, did you have any information items you wanted to highlight for us?
I didn't have any information items that I wanted to highlight from the notes, but I did want to say that the county has agreed to start integrating in-person and hybrid, some hybrid meetings, some in-person meetings between now and September. And the idea is that after September, that all regular meetings would be in person. So that would mean our target would be for our first in-person meeting to be October. And I don't know that that's a requirement. So it's possible we could ask, can we continue to meet virtually if you all want to? So between now and October, it'd be helpful for us to sort of take the temperature of the group and see what's preferred and what's allowable. Thank you.
Yeah, just informally, I don't mind coming and meeting in person. I do teach and school doesn't get out until 4:05, but my principal knows that I'm on this board. And so she's fine with me leaving a little bit early on days that we have a meeting so that I can get over to Fifth Street office. What do the rest of you guys think?
I think I'm okay either way, but I may have, as I have in the past, have to pick up my son. So that might not be possible for me. So the virtual thing would be possibly, I don't know. We'll see what happens next year.
I'm fine either way. I would be glad to meet in person, get to see all of you in person for the first time would be wonderful. I haven't gotten my teaching schedule for next year yet, so I'm hoping there's not a conflict. I'm expecting there isn't, but things have been changing in our department, so I can't say for sure. If that would be the case, I'd let you know ASAP.
And there's nothing magic about this time as well.
Okay.
This time is a conflict for a board member who likes to attend. This is a conflict for the deputy city manager who likes to attend. So there are some who would love for us to reconsider this time. And so once everybody's schedules are in hand, maybe it's worth sort of putting our heads together again and saying maybe we need another spot. So nothing is fixed.
And I don't know what the rest of the department of what your daily schedules are like, but like for instance, mornings would also be possible for me. I don't know if they are out of the question for anyone else, but so like personally, it doesn't have to be in the afternoon. I'm open to moving it to another time of day, and we can discuss that when it gets closer to the time. But if it would make it so it's easier for people, for more of us to attend, then that's certainly something we could consider. So we will table that and we'll bring that back up. You said hybrid, Kaki, they've agreed to integrate hybrid and in-person meetings. And when we say hybrid, we mean some people are in person, some are zooming in. But by October, they don't want anyone to really be zooming in any longer.
I think they're saying all of those things. They would prefer that we're all back in person, but they're also recognizing that that may not be possible or preferable based on context conditions or what we've gotten used to in the last couple of years. And so they're allowing for technology to be used for hybrid. So we do have in our both conference room the capacity to Zoom somebody into a live meeting. So I need to clarify to make sure that there isn't some requirement. There are requirements for the public bodies like the Economic Development Authority and that kind of thing, but the same rules generally don't apply to us. And so I'll just double check before we have our final conversation to make sure I'm not missing some regulation somewhere.
Okay. Thank you. Did anybody have questions or want to talk about anything that are in the information items?
Inley, just great job. The Bright Stars program, all the work that they're doing with the families is amazing. It's and super productive as well, obviously. Jobs and furthering education. It's really exciting. So yeah, it's amazing.
I made a few notes. I highlighted mine. I'm trying to get that open so I can find mine. I had a note that I made in section 2, Adult Services News, letter A for World Elder Abuse Awareness Day. I highlighted where it says, post on social media, the county Twitter, Facebook, and Instagram, the signs of elder abuse and what to do if you suspect abuse. And I just wanted to request that our board members work on amplifying that message and try to share it on social media or share it in our friend circles or even email it out to your contacts in your email list or something, just to help the county spread that word. And I know a lot of things, I'm not on Facebook much anymore, so I miss a ton, I miss a lot. And so anything that we can do as board members to help spread that would be helpful. Kaki, could you make sure that whatever that social media post is, whether it's a graphic or it's a blurb with words, could we have it emailed to us, to the board, and then that would help remind us to share it?
Sure, absolutely. But between Wanda, Lisa, and I, we can certainly capture whatever those things are. Yeah.
Okay, thank you. So there was that. And then number 3, self-sufficiency team news. I was a little bit confused. Hold on, I need to call. Sorry about that. The last sentence, I think something must have gotten left out because it doesn't quite make sense. It says during the week, a representative from WIOA, TJACE, PVCC, as well representation from DSS to provide support. I don't know what that means.
I think it's as well as representation from DSS to provide supports. So that means that we have representation from PVCC, WIOA, and DSS on site at the Workforce Center to provide supports. And that's the whole point of the Workforce Center in its new designation is to have representation from multiple systems around workforce and development on site in one spot. And often that will include supportive services from the community members, like food banks or other folks, depending on what the needs are, to be on site so somebody can essentially, the idea is to have one stop to be able to meet all of their workforce needs.
Okay. So it doesn't have anything to do with that job fair that was before?
Separate thing. Yeah.
Got it.
And
then
is the workforce center, where is that located?
It's in Fifth Street, right before you come through the to the kiosks at the front desk for us, off to the right, so that you don't actually have to go through the kiosks to get access to it. There's a couple offices there, and then the workforce center. So when people come, that's where they'll sit, and people come and fill out applications or get from Juan Diego Wade sort of a list of what's available out in the community, and he'll help them apply and look at their resume. They'll do that all in that room. So there's probably 4 conference tables in there spread out. So multiple people could be both either providing services or taking advantage of services while they're there.
So does the workforce center then work with the Virginia Employment Commission?
Yes.
Okay.
Yeah. So, and we're all part of the Piedmont Area Workforce Development Board, where we have intentional MOUs and connections with all of those folks at the federal, state, and local level around workforce development.
Okay.
And Sam Spencer, who will be here around 4, is the actual person with those relationships.
I find that I'm trying to put all these pieces together in some kind of coherent, understandable, like what are all the different agencies? How are, I could almost use like a mind map of some sort of like, how are they working together, what their roles are. And I was thinking of the same thing under benefits news, where there's the family with children's benefits, there's the adult benefits unit, et cetera. I don't know how those all like work together. Like, what's the structure of the benefits unit? You know what I mean? Like, just as I'm getting my feet under me, I'm just trying to figure out how all these things fit together. So.
Me too, Natalie. And I suspect there are, there certainly is, like an org chart that can show you some of how we organize those things, but that's not necessarily going to tell you how they connect together or how those organizations, those units connect into the community, but it might be a good start. I'm happy to send that to you.
Yeah, that would be awesome. I think that would help me as I'm reading through things, trying to put it together mentally for myself. So.
And we have a couple of anomalies in our reporting structure, in that adult protective services, because of the nature of their direct service, might in some organizations be more closely matched with the CPS chain because the work is so similar. But in our org chart, adult protective services actually reports to the benefits boss, and that's Wanda. And then self-sufficiency team, which might traditionally actually be included with benefits, is actually reports up to Alice Micklem, who is the child services boss. And so those are just a couple of anomalies. They make sense anywhere in the way that they don't necessarily make sense anywhere either. So anyway, those are the only anomalies. The rest of it, I think, will be congruous.
Okay, awesome.
It might be nice for our first in-person meeting back, whenever that is, to take a tour. I remember taking one a few years ago. We toured the building and we were introduced to a million people and we saw a ton of offices, but it did help to wrap our minds around how people are working together and just how complicated what it is that you do actually is. So if we could have a tour and include the workforce center in that as well, that would be great.
Yep, that sounds great. Happy to do that.
And I want to make sure we say hi to Willie Mae. Hi, Willie Mae. Nice to see you. Or glad you're here.
My apologies to you all. I could not get in for the life of me.
You made it. You made it.
On the day that I needed to get, I'm like, are you kidding me? This technical difficulty. So I am so sorry. Hi, everyone. How are you all doing?
We're doing all right. We're getting by. I'm sitting in a public library because that's the only internet I could find. So, we do what we have to do. But I've had the same problem before where my link wouldn't work and I had to frantically email Lisa and Amy. And I was like, help, I can't get in the meeting. So I think it's happened to all of us.
Well, I tried to shoot an email to Karen and it popped back. It's like, no, this person doesn't. I was like, are you kidding me? No. So again, apologies.
So Willie Mae, we're talking about the information items. Did you have any questions or want to talk about anything that was in the information items?
Well, I didn't get a copy of that sent to me. Was it sent to me earlier?
I sent them out Friday with your Zoom invite.
And normally it's an attachment of the email.
Is it? Look right quick.
Sorry, I'm moving into a smaller room.
Sometimes, Willie Mae, you just have to keep scrolling down because I also didn't realize that they're attached.
Oh, okay.
Yeah, it's at the bottom of the email.
you all want to go on, don't let me hold you up. I'm gonna go keep searching, strolling to find it. I'm sure if I have questions.
I was actually wondering about the benefits, the cooling benefits. How many people were, I didn't know if that number was in there, but I was just curious. But if you don't know, it's not critical. Just,
You know what, it was in our PowerPoint, the number of cooling and heating beneficiaries, so I can look.
I was also wondering if there's any program that helps people make their homes more energy efficient. Because it feels like that might be helpful.
There are. So 1,313 households received both cooling or heating last year. And many families, of course, received both from us, just based on their eligibility.
That's a lot.
Yeah. So there is a program called LEAP, which is
Oh, yeah.
So our Department of Facilities and Environmental Services partners with LEAP to provide a subsidy or sometimes a full coverage for energy assistance audits. And then both AHIP and LEAP and the Facilities and Environmental Services team in the county partner together to help cover the cost of some retrofits to make sure that people are able to take advantage of whatever the audit reveals, either, improved insulation or improved ventilation, depending on what they find.
Do we ever target the people that are receiving these benefits?
Yeah, so they have a good crossover, and sometimes they actually ask us to verify eligibility, and sometimes we make direct referrals to them. So yes, they're working very closely with us. And of course, the folks at both LEAP and AHIP have a wait list for people who are eligible, who may be immediately eligible. So they look for county residents, who are already receiving benefits from us, sort of easy yeses.
Right. Very cool.
And I think actually, I may be wrong about this. I'm certainly not going to say a number, but I believe both the Facilities and Environmental Services and LEAP and AHIP all received some ARPA funds, some of the emergency assistance funds, to be able to dramatically extend the number of people who could get this benefit in the last year. Also, we have, folks, this is actually, as I'm talking about it, it's a pretty interesting cross-departmental collaboration without being celebrated as such, because both our housing folks who do inspections and the community development folks who do inspections have the opportunity to see houses and get that may raise concerns that then get referred to this internal program and get the services from LEAP and AHIP as well.
Willie Mae, were you able to find those files?
Yes, I'm
good.
I'm looking through.
Okay. There was another question. This is the last note that I had in mind. At the end in administration news, one of the bullet points, it says director meeting with all managers, supervisors, and seniors. And I've heard that term seniors before. And so I'm imagining it's people who have been with the department for a certain amount of time, or they're in a certain managerial supervisory position. But how do you determine who is a senior and who is not?
It's a really big question you just asked. So I'll break it into some components, because it's not always about seniority with us. It can be just about experience or leadership. And so seniors in our model do not directly supervise, but they do provide some guidance and direction, and they follow through on sort of compliance and activities. They may have meetings with staff and sort of otherwise help move the work along without being direct supervisors. And so every unit uses their senior slightly differently, or senior slightly differently, sort of depending on their wheelhouse, their interest, their skill set. And then, you know, presumably this is one method in a department, or maybe if it's even if it's a field, I'm not sure, where there's not a lot of automatic progression to go from to take some steps from worker to senior to supervisor, you know, potentially to manager. And it creates an opportunity for somebody who's been doing their job for a long time to take on some additional responsibilities and additional authority without necessarily becoming a supervisor. So it generally is comes with its own job description for each unit and a higher salary than the regular workers.
Got it. Thank you.
Wanda, did I miss anything around seniors?
No, you're exactly right. This requirements to be a senior are different between each program, but often it comes with you have to have a minimum of X number of years as a line worker in order to be eligible for a senior position. So that's where the natural progression of seniority starts to play, but not everybody wants to move up in level. So, and sometimes people want to be seniors, but do not want to be supervisors. So that's where a line staff member who didn't have the opportunity to be a senior could jump into a supervisory level position. So, and you're right, Khaki, seniors are used differently in every unit.
Got it. Does anybody else have any questions about information items?
So the
Really,
people,
Mia, go ahead.
I just wanted to ask a quick question. So the people in the senior positions, how long do they generally stay in those positions? Do one get in a position and stay 3 to 5 years, or is it a turnaround?
I see Wanda nodding. I don't know the answer, but Wanda does.
Well, there are a lot of seniors that will stay 3 to 10 to 15 years because they don't want to go into supervision or management part, but other seniors stay a couple, 2 or 3 years and then move into a supervisory position. But so there's both sides of that. Each step you have to apply for the next position. So we could have a senior that constantly applies for a supervisory position that doesn't get it, you know, for whatever the reasons are. But yeah, there's no you have to do this before you can do that. Except for being a senior, you have to have experience already as an eligibility worker or as a line worker, whatever the situation may be, before you can become a senior.
And do you try to promote within, or usually, or?
We love to promote within. Every position, it's based on who the applicants are and who the pool is. So every time we're going to hire the best person we can that applies. So sometimes the best person that applies is somebody that's in another locality that applies for a position here, got much better experience, much better qualifications than somebody internally does. Other times we would love to always be able to promote our own people. And so it just depends on who applies.
Thank you.
So I think that might be it for information items. If no one else has any questions, but you can certainly, if you think of more, you can pop in later, or we can also email the staff and ask those if any of them come to us after the meeting. One thing that we did skip earlier in the meeting was approving the minutes from our
She did say reliable internet, right?
Yeah.
Our last meeting,
Oh, yeah.
and we were waiting for a
Oh, Mary, it's coming in and out.
oh no, did I freeze?
You
Yeah.
did, but you're back
Oh
now,
no.
sort of.
Oh.
Okay. Well, maybe Amy will have to take over.
Yeah, we can just call, does anybody have changes to the minutes? If not, could somebody move to approve?
I move to approve.
A second? I'll second. All in favor? Aye.
Bye.
Okay, that was unanimous. Yeah, actually, do you want me to pull up the agenda? Sorry, because I don't have it up. Do you want me to keep going, Mary, or?
Am I back?
Yep,
Okay, well, that's good. But it looks like our presenters are logging in. So if we've approved the minutes, then we can do the presentation next.
Right. Before they get started, I want to sort of frame the presentation a little bit. So when I got hired, the sort of county leadership was pretty clear that they were hoping that they hired me in large part because of my human services experience and not necessarily because I had deep and wide knowledge in social services specifically. And in fact, you see that play out every meeting. There are social service specific questions that I have to refer to one of the experts who are with us. And so a couple of things around the sort of shift to a human services model. One of those things is that it seems pretty clear that 2 years into the pandemic and with hiring freezes and with the significant attrition we've seen in staff, that the DSS function was in trouble, not in big trouble, just still doing really important good work, but needing an internal advocate. And so my efforts have been really intentionally focused on trying to serve as that advocate for DSS since I started, as opposed to sort of coming in guns blazing with some interest in some shift around human services. And I will tell you, it remains to be seen whether whether the sort of DSS foundation is strong enough to shift away from that advocacy or not. I cannot imagine we're getting to a point where I wouldn't be advocating for DSS, but how much of my time could be spent doing some other activity. At the same time, there is strong interest on the part of the board, senior leadership in the county, and certainly in the community for the county to provide services beyond our mandated platform. And so thinking about what that would look like is one of the things I'm going to spend the next 6 months doing. And so I hope to do a human services needs assessment. In large part, that was sort of the idea for it was sparked by Natalie's suggestion in our advisory board report to include some data around current state for the community. And that was so powerful in terms of moving the board to understand sort of what the scope of need is in the community, that it seems very appropriate for us to sort of do a broad-based sort of look at what our current state is around human services needs, where are the gaps that we could fill. We're not going to fill all of them. So what are the ones that are a good fit for us, and have some understanding of what that would be. And that will include talking to all of our department units to find out sort of if you had somebody who wasn't part of the mandate, what could they help you accomplish with your current clients? And one of the ways that I think of that is the connective tissue between making a referral and actually landing that referral. So somebody who sort of helps somebody get to the spot where the service that's been referred is actually being delivered. Some people refer to that as a warm handoff, but our folks are so busy that they're not able to do that a lot of the time. And so could it be that we have somebody who does a human services function, which is just to take somebody from the DSS staff to the community-based service provider and make sure that they get connected there. Also, you all have heard that we've pulled folks from the affordable housing wait list for the Section 8 vouchers for the housing choice vouchers. We have a tremendous number of people who get vouchers who cannot find housing. And they cannot find housing because we live in a community where there's a serious lack of affordable housing, but also because it's kind of a special skill looking for housing and convincing a landlord to take a risk on you. And so sometimes having housing navigation services can be that connective tissue between the service that we provide and you actually being able to take advantage of it. So something like this idea of navigation around our systems of care, whether they're internal or external. But I'm sure there's other things. There's other ways in which human services sort of folks could be helpful. So we're going to do a human services needs assessment. We're going to talk to everybody internally and externally about what they need, what they'd like us to do better. There are some structural changes that come with this, like we probably shouldn't call ourselves DSS if we're going to do human services. And so if we're going to call ourselves something else, what should that be? There are some people who are like Health and Human Services Division. There are other people who say, Human and Social Services. There are some people who say we shouldn't do this at all. So, but a name change will probably be part of that. When you talk about a name change or a scope change, we have to include Virginia Department of Social Services in those conversations. Sometimes, because of the way we're designated as a partially deviating organization. So we have to follow the rules for some things for them, and sometimes we follow our own rules. And so this is truly inside baseball, but we might be in a position of changing some policy in order to get more flexibility. All of these are sort of like dominoes that have to fall before we can get to a place where we can develop any kind of full-blooded human services kind of response. And so I'm saying that right now we're pushing that first domino. I can't tell you how long it takes for that thing to fall to hit the next one, but we're starting it. And so we'll be reporting back to you certainly around the data that we find, what we hear back from units about what they might look like or want from human services. And so I thought it would be useful for you all to see or hear from two units in our current DSS configuration that provide human services. Services that are not necessarily mandated, that are driven by the needs of the client, and how it is that they provide their functionality as a way to jump off to push that first domino. So I see that we have both Sam and Erica with us. And so should you all do rock, paper, scissors to see who goes first? All right, 1, 2, 3. Oh, you. Does that mean you're Sam? Sam, were you paper or were you from? Okay. All right, Sam's going to go first. Sam's
Good afternoon. Good afternoon, everyone. I tried to create something in the middle of that, but it didn't work. So I guess I'm going first. My name is Sam Spencer. I am the Self-Sufficiency Program Manager here at ACDSS. What that consists of are some of the mandated programs that Kaki spoke of. So there is the VIEW program, which is our Virginia's Initiative for Education and Work. That is an umbrella piece of the TANF that Wanda oversees and the program of benefits. That program is basically the services side of families receiving temporary assistance for their needy families. So if a family is actually enrolled in receiving TANF, if they have a child over the age of 1 and under the age of 18, that mom, dad, or family unit is then referred to our program for supportive services, for educational support, and anything we can do for the family to be successful. The main goal of our program initially on paper is to help them find employment, but we all know that there are several different barriers prior to meeting that need of employment. So our last priority is employment. The first thing we do is address the need for that family. And so that can mean several different avenues of conversation. And again, we all know success does not look like the same thing for everyone. It's not a white picket fence, 2 dogs, 3 acres of land. It can mean getting my medical benefits taken care of. It could mean getting transportation. It could mean getting set up with working with Juan Diego Wade in the Career Center for resume writing and networking. It could mean making sure that my disability information is completed timely so that I can get my SSI. So we're doing a number of things specifically in that program for those mandated folks that are receiving TANF. There are some challenges with that because the state has some yellow and red tape. So we're not always allowed to, once we have the moral and ethical ability to do these things for our families, there's some tape there that we have to make sure that we're abiding by because the state requires us to do certain things in order to be in line with compliance. So that's an overview of our Virginia's Initiative for Education at Work. We now have another program that's called SNAP-ET. That is the SNAP Employment and Training Program. I'm giving you acronyms. I'm also giving you the actual wording as well, because I want you to have some glossary of some sort. The SNAP-ET program is similar to the VIEW program in a sense that if a family or a parent is receiving SNAP benefits, he is then referred to a volunteer program that states when your benefits are over, we're going to provide you with supportive services to move forward beyond the benefits or the needs that are being given to you by DSS. So we're working with adults. Sometimes those adults have children, sometimes they do not. And so this is a different population that we're serving, which requires a little more attention to detail to the parent. The VIEW program is more oriented to the family, but the SNAP ENT program is more to the parents. And so we're looking at connecting with PVCC, we're connecting with DARS more frequently because there's some mental health awareness that we're not sure of, or families may not be willing to address that. So we have to kind of tease some of that out, vet those clients before we're referring them to community supports. And our goal is to kind of be that conduit that has that conversation that oftentimes does not happen because our families often hear some verbiage or some wording that they don't quite understand. Our ability is to be the ABC 1, 2, 3 so that they can understand what's being said to them, be able to articulate that to someone else and feel like their needs are being met. We don't want to have conversations that are not fruitful and valuable. We want to make sure that we're giving information that's attainable and they can relate it to other people and pay it forward to someone else. If you have a community need and someone understands, well, I'm getting the services from DSS, what is it about? Well, this is a SNAP program. They're offering this. And so we are more mindful of how our conversations happen to these folks to build a relationship. And a lot of our programs are talking about relationships. It's about building rapport with our families so they feel comfortable when they have a need. We can meet that just by conversation and getting them to our resources that are going to be best available for them to use. The next one, I think you guys may be familiar with this, is our Career Center. And some of you guys know Mr. Juan Diego Wade, the vice mayor for the city of Charlottesville. We give him a hard time. I call him Steve Harvey of ACDSS, just because he's always doing something. Steve Harvey has like 8 jobs. Well, Juan does too. And along with that, it's more so the conversations that Juan builds with our families and our parents. Juan is also working with students. One of our goals is that we're trying to create a hub that we can kind of build off the K-HIP model, that we're also working with youth. Bless you, Amy. We're working with youth and at the same time building some camaraderie with families. So oftentimes Juan will meet with youth in the community. We're starting to go to the Latinx community over in Southwood. That is a barrier for us right now because there's not a lot of trust. And so when we go there, we want to build rapport. It could just mean a conversation, stopping by just to say hello, just to show that there's a face there that's going to help you find a job, find resources, find opportunities for youth and families to be able to get employment or get natural resources that they may not have. So our Career Center is open Monday through Friday. We are now an official affiliate of the Virginia Career Works Piedmont region. And what that means is that we've partnered to basically make our Career Center a one-stop shop. So that one-stop shop actually means that if someone wants to come in, for example, if Uncle Jim is coming in for long-term care questions that he needs to meet with someone in our office. And the nephew or someone is bringing him in. The 19-year-old nephew just graduated, not really understanding what's going on with him in life, but he happens to see that PVCC is in our career center and he's interested in education opportunities. He can go connect and talk to someone. We can then tell him, hey, by the way, on Wednesday, our WIOA representative is going to be here. So you can come talk about certifications and how WIOA can partner and pay for that so it comes out of pocket of zero to you. So those are our connections that we often try and build. And being that one-stop shop, we also have DSS resources that are available to those folks when they come through the door. So meeting the need of the human is ideal when we talk about that opportunity to build some conversations and relationships. We are now working with what we call the FEP program. And again, it's another acronym, but it's the Full Employment Program. The Full Employment Program is now meeting the need of the employer. So on the flip side of the employee, we're working with the employer. The idea is that we have families or parents that are enrolled in TANF and receiving VIEW. We are now going out to the community and marketing these folks to the employer. By doing so, if an employer chooses to hire one of our folks, we will then pay them a stipend to hire them. So we're now giving money to the employer to employ our VIEW clients for 6 months. Based on that 6-month employment, if the person meets a higher mark, because typically when a person starts working in the VIEW program, their benefits are ending because they met the income limits and it closes. But being enrolled in the FEP program will allow those parents and families to work for 6 more months, build some sustainable income, possibly, but start to budget knowing that there's going to be a time when the 6-month period may end, they don't have that TANF as that safety net. The employer also builds a solid employee, and after those 6 months, the employer can then say, we want to keep this person on, or give some informational interview tips on how this person can be a better employee for the next person moving forward. So it's a win-win for both employer and employee. So that is where we feel like on the employment services side, we're meeting the employer's need by having this conversation. How can we connect with you? How can we do this moving forward? And so we've got in contact with a restaurant. We have a childcare facility. We have a medical assistance site that we're working with. So we're building the capacity to do this. One of the things that have slowed this down is our pandemic. And with the state, again, red and yellow flags, they've said right now, no one has to participate in these work-related programs. So the work requirements have slowed down. But what we've done is we've vetted those folks that are saying, you know what, I really can't wait. My family needs this. I need this. I'm ready to go. And so we're putting a lot of emphasis on those folks, kind of getting them ready. When the state releases that mandate or work requirement, then we can actually pull in more TANF VIEW participants to actually seek out opportunities for the FEP program. And last but finally, not least, our child care subsidy program. And we all know that child care is a huge, huge, huge factor in our families being successful in meeting the need for each other. Here recently, we've been using the term daycare desert. And for that reason, we say that's because we have so many families that are in need of childcare, but we are limited in providers. For some of that, again, red and yellow tape is that our providers are not being paid adequately by the state. And so hence, folks are not wanting to participate and be a provider or in-home provider. There's a huge need for second and third shift providers because let's be honest, most families that we're working with are not always working 9 to 5 or working on a weekday. And so we struggle with finding that opportunity for childcare in the second and third shift or on the weekend. So families don't have the opportunity to work like they should. And so with that daycare desert, we are now focused on having a daycare expo or job fair, so to speak, in August here at our DSS. We are working with our marketing team as well as working with community partners to build a flyer, build out some information, start to message out about the need for providers and about the need, how to become certified. So it's more so a job fair and informational interviewing piece that's going to happen in August. We hope to kind of drum up some energy and some efforts in that. It's a marathon, not a sprint. We know that. Again, that's also some state mandate requirements that they put on hold for that. But at the same time, that's a need that has to happen for our families to feel like they can move forward and move the needle. It's very hard to gauge someone in becoming a childcare provider when childcare providers only paid $10 to $12 a day, and they can go to Target, Chick-fil-A, Kroger, and these other places and make 15 and work a set shift. And so it's difficult to understand that piece, but we know that we have to keep lobbying and having these conversations with our regional folks and our state folks to see if we can increase that pay so that the quality of care can be better for our children, so that the parents can feel comfortable leaving their children in a setting where they know they can be there and go and provide for their family. So that's the important piece about that. When we talk about the childcare subsidy piece, it's not perfect. We know that. But at the same time, we're working to try and provide an opportunity to build and uplift opportunities for families, parents, and children. And so that human need is very important to how we work together. And that's more of a segue to what Erica does in family support, because we often lean on them when it comes to, hey, we're having this family or group of families that we're working with. How can we gauge one another? We are closely working together with our LEP population. Our refugee resettlement information is going out very well. We're working close with IRC international neighbors, but oftentimes the folks that we see have exhausted those benefits. So they come to us as a last resort. And so then we have to figure out how we can navigate those resources, because oftentimes when we do have our refugee population, they've reached all their resources and they're with us. And now we have to go back to those resources to advocate for them. And that's tough at times, because they're stretched, and we have to figure out ways to advocate and engage those people to become partners once again. And so that's why Erica and I work closely together with family support to bridge those gaps oftentimes when we don't have the resources to engage. So I know I gave you a lot at one time, but I wanted to also give you that information so that you could take down some notes. And I will be more than happy to pass along some pamphlets and flyers to Lisa or Kaki to share with you all so that you can kind of digest some of the things we talked about. But I wanted to make sure that you had an idea of the 5 or 6 programs that are covered under my umbrella before Erica kind of speaks to some of the issues that they're facing as well. But our challenges are similar to what we see on a day-to-day basis, that people are struggling. We do a disparity survey each month where I have my staff actually, we have a survey that we actually do each month, that we have a conversation in our staffing. And each month we talk about the trends that we see. There was one month where we saw that we had over 60% of our white female parents were receiving childcare, and only 30% of our Black female parents were receiving childcare. So I broke that down and looked more detailed. It was because some of our Black female parents were looking for in-home providers. They weren't accessible. Then I had 10% of another population just didn't complete the survey. My Hispanic population just didn't do it. They didn't complete the application. But then there was a population of my white female participants that did everything correctly, that had all their needs met, and they were given the opportunity to be approved. So that told us we need to be more articulate in how we explain things to our Black and brown population, to make sure that we extend an additional hand to the Hispanic community and let them know there's an opportunity for you to grow. There's an opportunity for your children. So we don't want to leave anybody behind because we're not doing our small piece. When we look at our employment side, we looked at the disparity of how many people were employed and how many were not. We looked at our folks that had charges, our reentry programs. And so we had a lot of those folks that were not given opportunities. Their income wage was $8 to $9 versus those that were not offenders were at 15 to 16 to 17 bucks an hour. So what that told us, we need to reach out to OAR. We need to reach out to Region 10. We need to reach out to our community network to find out how we can advocate for these folks that are having these challenges to meet the need to move the needle so they become successful as well. So we had to find those employers that are offering that opportunity. So Juan started digging and started reaching out to the employers that are willing to offer to those that are entering to our reentry programs to find better opportunities for them. And so we're being successful in that manner, but it takes a little more digging. And that's the human services approach to say, yes, we see these things, but now how? Okay, what's the why? Why are we going to move forward with this process? What do we need to do next to include those folks so we're inclusive in our approach? We don't want to single anyone out. It's about being equitable and inclusive in our approach and how we do these things. So those are just some avenues that we're using right now. to increase our needs, to increase our resources, and find out ways we can fill the gap. Not everyone's doing that diversity disparity survey. That's something we're doing in the self-sufficiency program. We took that on because honestly, during the George Floyd and everything we saw that happened because the pandemic slowed us down, we actually saw it. We kept hearing that you're only doing for Black and brown people. You're only doing this for these people, this population. Why can't you do for me? So I said, you know what? Let's make sure we're actually doing this for each other. Let's see if we're really doing this. So we took the time and came up with the survey to figure out if we're actually doing what we're saying. We're actually talking what we're walking, what we're talking. And so we are, but there are times where we do see trends where people are not getting opportunities that they're having. And so it's important that we continue to have these conversations, uncomfortable or not. We need to make sure that we're equitable and inclusive in our human approach and our human touch with services and needs. So again, I know I said a lot in a short period of time, but when I talk about this, I'm passionate because I think it's very important that everyone hears the same message and the verbiage comes across clear and concise. So any questions? I'm open to that.
I have a question,
Yes.
if my internet is working well enough. I'm intrigued by everything you're talking about, and it is super, super interesting. With so many like are now hiring, give us an example of one of the employers that's participating.
Sorry, you froze on me again. Say it again.
So what is an example of an employer who is participating?
In the FEP program, the full employment program, YMCA.
Ah, cool.
So the YMCA is working with us. We had them as one of our employers that we leaned on the very beginning. We had some moms that had children that needed childcare. And we're like, what a great opportunity for a mom to work at YMCA and have her child go there. All the while building your credentials to become a provider and taking advantage of the environment that if your child's there, you can be there. So when the YMCA is closed or the childcare is closed, you can get your child. You can take her, drop her off, pick her up, and leave. So it's a win-win in that situation for doing that. We also are partnering with the name escapes me, but you guys know it. It is over at Jefferson. It is the restaurant. Pearl Island, yes, yeah. Pearl Island. We partner with Pearl Island as well. So they're looking to hire our folks as well. I don't like to name drop, but we also are working with the GO program with Antoine Brenton as well. So we're finding opportunities to meet the need. We're finding opportunities to make sure our partners are aware of what we're doing. We have a really great connection with Network to Work with Ridge and Frank. So we're trying to make sure we're vetting these folks. So when we do have the opportunity to move the needle, move it to the next person, we can pass them to Frank and say, hey, Frank, we think we got a person that can really win right now. They really have an opportunity. They had some obstacles early on, but we think we can get them there. Childcare is taken care of. They're getting TANF right now. SNAP is good for them. They need a next step. What can you do to help? So that's where we are. And yes, those are two employers that are working with us right now and being successful in that need as well.
Thank you.
Any other questions? Again, like I said, I'll send pamphlets and brochures and information to either Kaki and Lisa, and they can disseminate that as necessary. But I just wanted to give you guys enough information that you felt like you left with some acronyms and some verbiage that you can use out in the community when we do talk about the human services and human service approach and how we want to connect our families to successful opportunities. So thank you.
Thank you so much, Sam. Can you hang out in case there's questions after for everybody?
Sure. Yep.
Erica.
Hi, that's tough to follow. I think I wish I had won the paper, rock, scissors battle, but I'm Erica Jenny John, and thanks, Sam, for sharing all of that information. It's a great segue into what I wanted to focus on today. And so just as a frame of reference, I've been with the program about 5.5 years, almost 5.5 years. And we've changed a lot in 5 years. And especially during the pandemic, I think is when we've made our biggest shift and our most growth in how we're delivering services. So prior to the pandemic, we had, I had 8 family support workers. I had 8 full-time positions and 1 part-time position. So I'm trying to do the right math here. So I had 9 family support workers, 8.5 positions. And we served at that time 13 schools directly. And so everything that we did was focused on these 13 schools, 4 middle schools, 9 elementary schools. During the pandemic and leading into the pandemic, we were recognizing that there was a lot more need in the community, a lot of folks experiencing financial hardship, housing instability, and things like that. And we were starting to get more calls. So we were trying already to figure out, how do we serve the entire county, not just the students and families that attend these 13 schools, because it never felt good as the program coordinator to get that call from a parent saying, hey, my family needs your help. And my first question to them had to be, well, where do they go to school? Because if they didn't go to one of those schools, then we couldn't serve them. So I decided I didn't like that. I wanted to change that. And so what we started to do as we entered the pandemic is we started to evaluate, how could we serve folks outside of our house, outside of our families? Like, what would that require for us to go outside of our school building? And then the pandemic hit, and it created this great opportunity for us to do things virtually. And it really helped my team stretch their understanding of how we could do virtual social work. And I am proud to say that today, at this most current school year, we served 21 out of 23 schools directly. We did that with 1 less position. So at the beginning of the pandemic, I had a staff person who had resigned, the position was frozen, and then a year later, that position was reallocated. And so we have not gotten that position back. So we're now doing this with 7.5 positions, and they are serving more families and more children. And so we are now serving on average about between 70 and 80 families at a time. And so that's 120, 130 easily. That's how many kids we're serving. Prior to the pandemic, we were serving about 70, 75, 80 kids, 80 children, period. So it could be 1 child in the household, or it could be the whole family. We now count our caseload size by family unit. So we are trying to start grabbing the numbers so that we can accurately say we're serving 70 families with 127 children. And we're trying to do a better job of grabbing that so that we have that to share with folks. And so that's just a little bit that I wanted to highlight up front, because I want you to have an understanding of kind of the structure and the resources that we have available to us, so that when I tell you about all the amazing things my team does, you will really be blown away by the work. I mean, these ladies, they happen to all be ladies on my team, but these women truly are amazing. We don't have turnover in the family support unit. We are one of the few programs we're the only program in child welfare right now who did not experience significant turnover in the last couple of years. We're getting ready to face a little bit of turnover as I am leaving my position to take on new adventures in a week. I shudder to say that. I know Khaki loves it when I bring that up. But yeah, I know. But we have a great team. And when you ask them why do they stick around, it's because the work that they're doing is truly rewarding and meaningful. And when they went to school, when the one who's a social worker, when she went to school to be a social worker, this is what she thought she would be doing. And so we have our hands and feet in the dirt with our families, and we are doing the real work. This is real boots on the ground social work. So a lot of what we're doing fills in the gap. I guess I picture like a sifter. So when you talk about all the mandated programs and where people fall in and plug in, everybody, there's a few people that squeak through. We're really looking to we serve the folks who don't fall into any of those categories of the mandated services. We have folks who receive Medicaid, we have folks who receive SNAP and TANF, of course, but outside of that, like, we're serving folks who don't have enough bad stuff going on in their lives to qualify for the significant the CSA funding that provides clinical services for kids to help reduce the risk of foster care and the need for DJJ placement or residential placements for mental health reasons. So we're trying to grab them before things get bad. And sometimes that's just really challenging to do, because again, we don't have a pot of money that we can resort to say, hey, you know what, instead of acting out, kiddo, let's pay for you to do this and this. so that you have a positive outlet where you can learn new things. We have a very limited pot, about 17,000, not about, I know the exact number, $17,866 each year of our Promoting Safe and Stable Families grant money that we use to provide extracurricular activities. We're able to help pay for some household materials and rent, and then a small little piece that we can do for transportation under very strict guidelines and rules. And what we've really seen in the last few years is that the need for rent and housing and finances and beds and sheets and linens and towels, those needs are just through the roof right now. And so that's a tremendous amount of what we're doing right now in serving our families, is just to help them meet their basic needs so that they can get to work and be productive, and so that these kiddos can get to school and be successful academically. When I think about some of the families that we served this year that stood out to me, I have a couple. So we have one young lady who's an elementary age student, and she's got some family history, CPS history, and lots of history over the years. But she and her mom are doing pretty well, so they're pretty stable right now. But she still has some needs, some social skill deficits, just connecting with her peers. She stutters and is very aware of that, and very much impacts her ability to connect with her peers. And so we were trying to be creative, and we were able to find horseback riding lessons, which are outrageously expensive, but we were able to find some. And we've been able to pay for, I think we paid for probably 10 or 12 sessions at this point, all of which is around probably $800-900 total that we've invested thus far from our grant money. She is more confident. Her teachers have noticed, her parents have noticed, her family has noticed. Within a week of doing her writing lessons, they just described a whole other kid. She finally found an activity that she could connect with, and that she felt confident in and able to be successful at. Her parent is thrilled about it, is scrambling, trying to figure out financially how can she move things around and shift things around so that this is something that they can maintain, because unfortunately we won't be able to maintain that rate forever. Mom did send permission to share a picture if folks would like to see a picture of this young lady sitting on her horse. It is just wild. Her stuttering has significantly decreased. Her engagement at school significantly increased. Her grades improved, and she's just getting along better and better with everybody. Let me open this up and I will share. Hopefully you're able to see it. And this young lady's name is Paisley. And we just today, I got another request to help purchase some writing equipment and things like that. So, oops, wrong button. So that we can help her with a writing camp, which will be, I guess, a little bit different than, are you able to see this picture? So that's Miss Paisley, and she truly is a neat little young lady. This is not an activity that she and her family would have ever explored or had access to without the connection to the family support worker. This is outside of their day-to-day normal life, and certainly outside of what mom is able to provide. And now I cannot find the unshare button. Bear with me. Well,
Erica, I just wanted to ask you how you came upon the idea to do this activity with Paisley. And I'm simply asking because I actually remember 25 years ago, I can't believe I'm saying that, when I did graduate work in education, seeing research on that very thing, on the empowerment for women, particularly in horseback riding, for confidence and all those things. So I'm just wondering how you fell upon it. What a great idea. I am sad it's so costly, but
yeah, I give all the credit to Karen Bright, who is one of my family support workers, and she's been around this community and with the agency for, I think, 22 years. So she knows all the ins and outs. And where we were kind of stuck is some insurance companies will pay for equine therapy. So if there's a specific mental health need and a treatment plan, and the provider has those credentials, then there are some insurances that will cover that cost. Through CSA, we often cover costs for equine therapy as part of the service plan that we support for families. Unfortunately, this family doesn't have access to any of that. Paisley's needs do not rise to the level where she meets the criteria for CSA funding. But Karen was able to work with the riding instructor, and I think that they negotiated to land on the most affordable option possible. But it was just something that they thought, we haven't tried this before. She likes animals. Let's see how it goes. Also knowing the same research that you mentioned, Natalie, about just the amazing connection between people and animals and what that brings about. So they're working really hard to be creative and find other ways to, like, I think in the riding community, various people pitched in and said, well, I'll let her use my horse, or we'll pitch in and help out with the cost of feed and equipment and things like that. So I think in that local network, there's a lot of folks that have contributed to this.
Awesome.
Yeah, another example is, again, we have a lot of families that we serve who aren't eligible for any of the mandated services because for a variety of reasons. So we have one parent who arrived to Albemarle County and within just a short period of time had a major medical crisis. So it's single mom and two children. Mom and children are all undocumented residents, so they do not have access to most of our resources and are not eligible for many of the community, the community resources that are available outside of the department. She had to have an emergency surgery, was hospitalized for 2 months. She has an 11-year-old and a 1.5-year-old. We've got the call on like a Friday. I got the call on a Friday at like 5:30. Here's this situation. This family has no supports here. They have no family members, etc. So mom, 2 months later, was released with a colostomy bag. In 6 more months, she's going to have more surgeries. She's got some significant recovery and healing to go through. And we were able to help her identify a neighbor where the kiddos could stay with her. This is all navigating through interpreters, as English is not this parent's first language. We were able to get Harris Teeter to donate gift cards so that we could purchase groceries. Mom now has obviously a very specific diet. So we've been able to help her get connected with Loaves and Fishes, who provide 2 pickups each month, which we pick up and deliver to mom. She does not have a vehicle. We're trying right now to get her car repaired so we can help her get her car back on the road. We've helped them finish paperwork for SNAP and TANF. And then we were able to help the 11-year-old get some much needed dental care that he needed. And finding dental care that is affordable or even accessible is just about impossible. So how the amount of time and hours that were spent on this were just, I wish that in hindsight, I wish that I'd asked them to keep tabs on the number of hours just to reflect again the amount of time that they're doing as they're serving more and more people. The young man, like in the midst of all of this, one of the kiddos had been COVID exposed and tested positive. So it's just like one barrier after another. And that is our regular caseload. That's who we serve. We serve folks who are trying to jump through and navigate those hoops. Folks who don't know the language, don't know the culture, the community here, and are so appreciative. It's amazing. It's just amazing the feedback that we get from them and the opportunities to help them make the connections that they need to be self-sufficient, because that's our ultimate goal, is how do we help folks be self-sufficient? And 2, how do we help support kiddos so they're successful at school? We really want to foster that the engagement between parents and schools, because that shows better outcomes for kiddos as they continue through their academic careers. And we've done a tremendous amount of work this year around just building relationships within the community. So we have at least 1 or 2 of the family support workers who sit on the board for Families Helping Families, which is part of the school system, but they're just a wonderful, amazing group that we've been able to really connect with to help lighten our load on meeting those day-to-day basic needs, or those one-time needs. One time today, I need help with finding a mattress, versus kind of the ongoing needs that we're able to help develop service plans around to help them get connected. Let me see. I think that is, I mean, those are two stories that truly, I think, highlight our regular day-to-day. I think that an example of our success is we have schools reaching out to us that are familiar with our program, but don't have a family support worker, who are asking for one repeatedly. They are asking the school board for those resources. They are advocating within their buildings for those resources. And so we are scrambling in my last week to really, carve out our school coverage plan and take a different look at it, because it needs to shift from what we've been doing. We don't have the manpower to cover the entire county. We're doing the best that we can, and we're serving folks who are more at risk than they used to be. So we used to grab, and somebody challenged me on this a couple of years ago, and as we speak about our success rate in 99.9% of the students that we serve in family support do not enter foster care. That's a great statement. Somebody challenged me to dive into that and drill down a little bit and make sure that who we're serving is ever even a risk of going into foster care. And I got a little ruffled the first time that I was challenged on that. And I thought about it, I'll be honest, and I thought about it, you know what, you're right. We don't have anything in place to figure out what the risk level is. So those are some opportunities where we started to gravitate more to how the rest of child welfare assesses risk and what they do with that information. So we are serving now the most at risk who don't meet the mandated criteria. That's who we're focusing on serving is. So we're getting a lot more referrals from CPS when they've screened them out. So it doesn't meet criteria for Child Protective Services to intervene. So they'll send it to us and say, hey, this family's name just came across our radar. Can you reach out and connect with them and see what else is going on and then help support them? So we're getting more and more of those referrals. Which has been really exciting. And I'm really proud of this group that I have. We partner really closely with Sam's team. I think our work is very similar. And so we work really hard to make sure that our folks are connected with Sam's folks and with all of the different programs that are offered through the self-sufficiency team, because those are all things that help parents meet their needs and meet the needs of their kiddos. So it's been an honor to be a part of this team. And this is, I think, the third or fourth time I've had the opportunity to present to the advisory board. So it's always a great opportunity. And I greatly appreciate the invite to speak today and welcome any questions or feedback that you may have.
Well, I just want to say kudos to you and Sam. Awesome, awesome. Thank you. I mean, when you talk about the undocumented families that come in and, they're scared enough as it is, but thinking outside of the box and helping them makes a big difference. It makes a big difference. So thank you for the work you're doing.
Thank you. I really enjoyed that presentation. Sorry, Taki. And Erica, I just want to say that I wish you the best. I'm sad to hear that you're leaving. And I know you're going to leave a huge hole here. So best of luck to you in the future.
Thank you. I appreciate that.
I was just going to ask both Erica and Sam if you could think of additional tools or resources to try to be flexible and practical and responsive to the clients that you all have. Who would they be and what would they do?
I for a while there, and this was many moons ago, there was a partnership with a Region 10 that we were contracted, that we had someone to address mental health barriers or struggles. I know one of the things that we see in our community is that there is a need that is often not met. And some of that is being proactive in those conversations. Simply because if there's a conversation about some mental health struggles, there's often an opportunity to have some proactive steps put in place. That is one of our disparity questions. And I think I spoke to my direct lead, Alice, about this. And I said that, during the pandemic, we did this survey about disparity, and over 60% of my white families and populations said that they had expressed some type of mental health problems or struggles during the pandemic. And there was, when I surveyed the Black and Brown community, there was 2% that acknowledged it. That told me that there's a fear of speaking about mental illness among marginalized communities, especially those that we serve, because you do not want to be categorized or feel there's a stigma against you because you need to address that. Even those folks that are working in Fortune 500s or working in these big companies acknowledge that mental health is something we struggle with, especially during the pandemic, especially during COVID, especially experiencing that our families have lost and learned and relearned and refocused so much that we've had to reshape what we see on a daily basis. And so I do think that the ability to connect with some type of community support, that we can offer some mental health support and mental health awareness on an ongoing basis to make it seem as not fearful or as not as prideful to address, so that we can make sure that those folks that need that are getting what they deserve and what they require in order to be service, in order to provide for their families, in order to provide for their children, in order to provide for each other. I think the opportunity to have those conversations would be very valuable. And I think that's a huge, huge gap that we're missing right now in addressing the mental health concerns of our Spanish speaking, of our LEP, of our refugee settlement. They're coming from so much trauma, of our Black and Brown families, of our white families, of our children. It's just a need that we are not filling right now. And I think it's important that we have those conversations because it's a gap that is not being tapped into. And again, it's a huge thing because we have to hire people that are ready to do that. There's an equity piece there, there's a quality piece. So I know it goes beyond just that. But you talk about my dream, and that's making sure that mental health is something that can be addressed and addressed proactively, not reactively, because right now we're in a reactive state of addressing mental health, and we need to be proactive in that piece.
I agree, Sam, and I think there's a fear that's well-founded for Black and Brown folks that the system of care isn't ready to do the right thing by them, both because that's been true in the past and because most of the clinicians who work in that system of care, whether it's UVA or Region 10 or any of those, are white middle-class women. And so finding whatever that resource is, finding the connective tissue person who can have that relational conversation about mental health needs and then connect them, finding the array of appropriate good resources in the community is also a special trick. But they exist, right? We have a number of really good resources in our community, and so we just need to make sure we're directing people to those particular resources. Thank you. Erica, what would you?
I would echo Sam in saying that we really need help helping our folks deal with mental health. I think that with the folks that we're serving, we're trying to make sure they have food on the table. So mental health is way far away in their minds of things that they're worried about. And what we try to help them understand is the connection between, well, your struggle with getting up today and going to work is also related to your mental health and your children's mental health. Like, what does that look like? How do you even know what that looks like in your children before it's at a crisis level, before you're at Region 10 or the emergency room being evaluated for hospitalization or things like that? So I think for us, I would really, I wish that there was a magic pot of money that helped us meet the basic needs first. And then truly from there have I think one of the things I would like to have done in my program was connect with some evidence-based curriculums to help us talk to people about here's how to budget. What we kind of get hung up with is, well, who in Albemarle can teach our customers how to budget their money? And so we're trying to do that. And so we would like to be able to partner with folks who have a little bit better knowledge than we do, or have the capacity, the time and the resources to do so. So some of those kinds of resources I think would be really, really helpful from an early prevention perspective, which is what fits nicely into a human services model, is truly meeting people at where they're at day to day on their front door. We do a beautiful job of that. And we get creative, we do food drives, we have a food pantry that we've created now, and just all of these things to at least figure out how do we help provide people with some food, even if it's just to get through the weekend. A big request that we had over and over this year was families who were displaced and living temporarily in a hotel. Well, if you go to Loaves and Fishes or most of the food banks, they're not giving you food that you can prepare in a hotel room that has no kitchen and only has a microwave. So we've been able to work with a donor that we partner with through Kids Lift to tailor our food pantry to make sure that we have items that we can throw in a food bag for somebody who's staying in a hotel, we've got a family whose mom has 3 sons. All 3 sons are diagnosed with autism, and they are all very picky eaters. Picky eater describes to me a toddler who's being fussy. That is not what these boys are. It's well beyond that. And so we're able to, again, use that resource and be very creative. So that is a beautiful gift and opportunity of a non-mandated program, is that we can be very flexible and responsive in the moment. It just takes some real magic sometimes to get our hands on the resources that we need to be able to do that, to meet the need that we have in our community. So I can go on forever and ever about this program. I truly love it. I love it so much that I'm going back to doing that work in the field. I just feel like that's where I'm being called to do it. And it's because of the work that my people are doing, my folks, my amazing team are doing. I think the other big thing that if you guys could figure out how to resolve it, you'd all be trillionaires, would be fix our housing problem in Albemarle. I mean, we're working with folks who cannot afford to live in Albemarle. We are out, some of us, I'm not an Albemarle resident, but live and work for the county. And the first thing that we do with customers that come to us asking for help with housing is we help them look outside of our county. Seems very counterproductive. People love this community. They want to remain here. They love the relationship they have with their schools and things like that. So we really want to be able to help them remain. So I know that's a big ticket, but anyway.
Thank you so much.
Thank you.
Thank you. Amazing guidance just from 2 brainiacs about how to build human services from here on. You lose Mary? You did.
So, by the way, amazing. So but Mary just texted me, they cut off the internet at the library, so she had to leave.
Are you serious?
So I guess that's their way to get everyone out the door. So I guess, by the way, I just want to say how incredible, this is so, I have a child with special needs, and I had a navigator help me, and I know how important that is. So I'm so grateful for everything you guys are doing. And I just wanted to make one suggestion about the mental health piece, because I think people are really, really afraid to admit that they're struggling. And this, I'm just putting this out there, some of these apps or these, you can find someone online. I don't think they're perfect, but it gives people the anonymity that they might want when they're having that kind of crisis. So anyway, I'm just saying that is, could be a resource in a pinch. I don't think it's probably, it could be long lasting. Anyway, so thank you. Thank you for everything you guys are doing. And I don't see the agenda. So Khaki, or I can just click over to my other screen and look it up.
I think we just want to talk about message out.
Oh, right. Okay. Does anybody have suggestions? I actually think, Khaki, we should absolutely mention that you are going to be doing this 6-month assessment. And I would highlight Sam and Erica's work of what that really means, if that is truly what you're thinking about, Khaki. So that's my opinion. Anybody else? Natalie, Willie Mae?
I absolutely agree with you, Amy. I think it's crucial we get that message out because it really seems to be the direction that we need to go and some of the needs we need to be addressing. So.
Willie Mae?
I was just thinking, certainly, you know, we come in contact with a lot of community partners. So there's that ability, I mean, and the connections we go through with those community partners. So it's really important. The more you talk about it, the more you get the word out, you spread the word, the message goes through. And not just 1 or 2 times, but it has to be a continuous basis.
Okay, well, I'll type it up and we'll go out with the notes. Thank you again to Erica and Sam for joining us, talking with great passion and wisdom about what we need to develop in the next couple of years.
Great meeting. Thank you, guys.
Yes, thank you. Do we have to do a adjournment or no? Okay,
Okay,
okay. All right.
bye.
No other
Bye,
business.
everybody. Thank you.
Have a good night.
Thanks, everybody.
Thank you.